Great, thank you very much. And it's great to be here in Geary to present the findings of this research. So this research was commissioned by TUSLA, who was previously the Family Support Agency, and it was funded by the Irish Research Council. And it was completed by myself and my colleague in Maynooth, Dr. Katrina O'Toole, who's a psychologist. So Katrina was coming at it from a very psychological approach in terms of well-being, and of course me being a sociologist, I was very interested in the sociological dimension. So we don't have much time today to just go over the main findings. There is a copy of the report on the web, so I can direct anybody to that. And we also have hard copies, which I forgot to bring today, but if you let me know, I can send you out a hard copy. So, despite the considerable emphasis on access to non-parental childcare in the early childhood period, it's a huge policy issue. Much less is known about the effects of childcare at different stages of childhood. And of course, the Growing Up in Ireland data places us in a unique position in the sense that we can really begin to consider the whole period of childhood. So rather than just looking at a specific focus around the early childhood period, GUI offers us this really great opportunity to consider stratification patterns across the whole period of childhood. So specifically, the research sought to address, well, who is it that has access to non-parental childcare at different stages of childhood, from infancy up until middle childhood, so from 9 months up until age 9. So when they talk about childcare there, I'm really referring to both non-parental early childhood care and education, but also after school care for 9-year-olds. Are childcare arrangements associated with child wellbeing outcomes at all stages of childhood? And are there common risk factors evident across each of the stages of childhood? So the data, we obviously used the Growing Up in Ireland data, both the infant cohort and the child cohort. So we had captured children when they were 9 months old, when they were age 3, and again at 9 years. And again, when the study was being conducted, these were the data sources, or the waves that were available to us at that time. Uniquely, I think, in the Irish context, using the Growing Up in Ireland, we decided to use the data both cross-sectionally and longitudinally. So typically studies using Growing Up in Ireland data have sought to capture childhood at one particular period, and we wanted to use both the cross-sectional data and the longitudinal data to capture these patterns over the period of childhood. So the cross-sectional data provides a snapshot of children growing up in Ireland and highlights inequalities across childhood, but it also allows a consideration of the relationship between after-school care and child outcomes at age 9. And then a focus on the longitudinal data allows to capture the short-term effects of childcare in infancy on later outcomes at age 3. Now, we should just say a lot of the research on the outcomes of early childhood care and education typically focus on the effects of early childhood care and education at age 3 on later outcomes. And so what we wanted to do was really begin at the start and to begin to use the data which is available to us in Ireland to consider these earlier impacts of non-parental childcare on child outcomes. So we had a range of dependent variables, so the first being access to the type of childcare arrangement at 9 months, age 3 and age 9. We also used the gross motor skill development measures, the fine motor skill development measures for the infants, the socio-emotional development SDQ scores for both infants and 9-year-olds, and then the cognitive development scores, again, for those aged 3. And of course, anybody familiar with the Growing Up in Ireland data knows that it's just such a fantastic source. You have a range of child individual characteristics and child developmental measures, data around family structure and household employment, data obviously around childcare and out of school childcare arrangements, but also data pertaining to the family, the socio-economic profile of the family, and parental characteristics, particularly relating to the primary caregiver. So our analytical approach then was generally to use multivariate models, to look at how each of these factors, each of these independent factors influence the dependent factor, and to identify if there's still an independent effect of childcare arrangements on each of the outcomes. And we did this through the use of linear and binary regression models and also quintile regression. Excuse me. The quintile regression is a particularly interesting approach for those of you who haven't used it yet, because it allows us to capture variation in the outcome. So how is it that factors influence the outcome at various different stages or ranges of that outcome? So we use the range of variables, and typically we use a stepwise approach. And then, of course, we also use propensity score modelling, because we know that there's considerable selection into childcare effects, and that may bias the estimates in terms of our outcomes. So let's get descriptive. So we can see that prior to the implementation of the early childhood care and education scheme, the uptake of non-parental care among the preschool cohort had increased from 38% in 2002 up to 50% in 2011. And we know from the Growing Up in Ireland data that as children get older, the prevalence of non-parental childcare increases. So from 39% when children are 9 months old, up until 50% when they were 3 years old. So that was prior to the implementation of the ECC. And now the most recent estimates suggest that 94% of the cohort actually engage in the early childhood care and education scheme. However, this is very much at odds with the pattern of the uptake of non-parental childcare at later stages of childhood. So we see that there's been very little change over time in terms of the prevalence of the uptake of non-parental childcare among those of school age. So from 22% in 2002 to about 24% in 2008 and 9. And of course, investment in after-school care has now become a bit of a policy issue as well, due to the lack of public provision of after-school care. And those of you who are parents as well can appreciate the lack of public support for after-school care. So if we look at the handouts, I don't know if people have handouts, do they? Okay. So we can estimate, well, what are the factors associated with accessing non-parental childcare across each of the stages. So you can have a look at table A2. And basically what we see is that there is clear social stratification patterns evident at all stages of childhood. So we find that social class, household income, and household employment, as well as the primary caregiver, the employment of the primary caregiver, each have an influence on the uptake of non-parental care at all stages of childhood. And I think this is an important thing to note. So access to non-parental childcare, the patterns that we see in infancy and in early childhood at 3 years old really mirror those patterns at 9 years old as well. So typically we see that the skilled manual and the semi-unskilled manual groups are less likely to have access to non-parental childcare. We also find that those in the highest income quartiles are more likely to have access, and those for whom their primary caregiver works moderate to a large number of hours per week, they typically have more access to childcare. And we also find that households in which both parents are working are more likely to have access to childcare.
Can you explain what you mean by have access to?
In terms of the take-up.
Technically everyone has access to it.
Well, not necessarily. I mean, there's always a cost implication in terms of accessing a service like childcare.
So in other words, it's a one if they actually are using non-parental childcare.
Yes, it's a binary. So 1 if they're using and 0 if they're
Sorry,
not.
I would think that is not being accessed, but actually utilizing. Sorry.
Yeah, well, I suppose. Well, it is and it's not. I mean, there is a lot of there's a lot of reasons why people may or may not access. But in terms of looking at the population as a whole, it's interesting to see that we find these socially stratified patterns. So some of it may be as a result of women's decision making around when they have children and how much they dislike to work. But we also know that there are clear constraints for people accessing both employment and childcare as well.
I think what Chris is saying is you could have access and not take it up.
You could, but it's interesting to see the prevalence of these effects over each of the stages of childhood.
Just terminology.
It's terminology, but yeah, I suppose a more sociological analysis of it would, understand that there are a number of factors associated with that. So what we also found was that household income not only influences the type of non-parental childcare across each of the stages of childhood, but also the number and the type of childcare arrangements that are used. So household income has a bearing on whether young children are in multiple or single childcare arrangements, but also in terms of the type of childcare arrangements. So whether it's relative care, non-relative care, centre-based care, or parental care. So conditional on the use of non-parental care, we find that social class, household income, and the education levels of the primary caregiver each influence access to centre-based care, conditional on the use of non-parental childcare. So it's interesting that families with higher levels of education were more likely to opt for centre-based care at all stages of childhood. And again, this suggests that those with the better resources in terms of the economic resources, perhaps the social resources, but also the cultural capital involved in educational decision making among families tends to have a bearing on the uptake of different types of childcare as well. And I think this education impact is quite interesting.
Is there some country-city difference as well? That centre-based care may not be as available.
Well, I think we do have an urban-rural variable in there as well. But these are still independent effects when we control for that, or when we take into consideration that into consideration. But yeah, you're right. I mean, in terms of geographic access, that is something that needs to be explored a bit more. So, how does childcare in infancy influence child well-being by age 3? Well, we find that there is some evidence of the influence of childcare arrangements on short-term developmental outcomes as measured by fine and gross motor skill development. So we find that there are positive developmental outcomes by age 3 for infants who are in centre-based care at 9 months with regards to both gross and fine motor skill development. So if we look at the throw a test ball by age 3, we find that those in centre-based care, all else being equal, are significantly more likely to have passed that test. So those who are in centre-based care at 9 months. And we see in the case of the jigsaw test, which is one of the 3 fine motor skill developmental tests, that there seems to be persistent effects of being in the centre-based care in infancy, but when we take into account parental primary caregiver characteristics, we find that the effect is not so evident. What's interesting is that we tend to see this effect on some types of fine and gross motor skill developmental outcomes, but not all of them. And that's a bit of a puzzle. So it doesn't apply uniformly to all measures of fine and gross motor skill development. So that we attribute to perhaps the varied pedagogic orientation of centre-based settings. So prior to the implementation of the ECCE, there was very little regulation in terms of the sector. So now there's a greater emphasis on the pedagogic orientation of programs delivered in centre-based settings.
So just to get a handle on timing, your infant cohort are measured well before ECCE goes into.
Yes, they are. Yeah, they are. So this is why it's interesting, because we're kind of looking retrospectively to see how effective has this policy initiative been. So on the one hand, we know that, yes, of course, in terms of opening up access to non-parental childcare, it's been a huge equaliser, because we clearly see that access was socially stratified prior to that. But now we're also beginning to think about, well, what are the positive outcomes of that?
Can I ask you about first mother?
Yeah.
First mother stuff. So it seems to me that parental employment, just mother's employment at 9 months is negatively associated with first mother stuff.
Yeah.
But childcare is positively, childcare at 9 months is positively. So you're including obviously the high correlation between parental employment, especially parental employment and childcare. How are you accounting for that?
There is, and if you look at some of the gross motor skill development outcomes as well, we find that where I think it was the primary caregiver is unemployed, there's a positive impact on the gross motor skill development, which is contrary to what we might expect. But if you look at the type of gross motor skill development tests using the GUI, it could well be very much correlated with the types of activities that parents do with their children. So it could be the amount of time that they spend with them, for example. So in the case of throwing a ball, if a mother is at home, perhaps she's not throwing the ball with her child that much, but in a very effective centre-based care, they may well be working specifically on those types of gross motor skill development skills. Likewise, if the parent is unemployed, they may have more time to spend on that specific. So the measures, we probably need to do more analysis on merging the measures in some way to try and find a more nuanced understanding. But it's interesting that we're beginning to see these differences. Okay, so how does childcare and infancy influence child well-being in terms of early cognitive and socio-emotional outcomes? So again, if you look at table 26, and we use the strength and difficulties, and we use the total score, this total strength and difficulty score. And there is some indication that children in parental and relative care fare better, but these effects tend to diminish when other contextual family and primary caregiver characteristics are entered into the model. So we see, there's some sporadic effects there, but they tend to get washed out towards the ends of the models. The cross-sectional data, well, it reveals a positive association between care in infancy by relatives and very short-term outcomes in the area of communication. So there is a question there about communication outcomes at 10 and 12 months, and we begin to see some relative effects there. But there are clear longer-term effects of relative care on naming vocabulary scores by age 3. And of course, anybody with children will typically see how grandparents or relatives engage in oral communication with their grandchildren or, with their smaller family members. So we find here, is this the naming vocabulary scores? So we see that those in the care of a relative at 9 months, the effects are very strong and persistent across the models. And again, sometimes, that is all that grandparents have to offer as well, is those oral communication skills. In terms of the centre-based care, we see that the effects are quite strong, even when we control for family structure, early childhood characteristics and infant characteristics, but once we take into account social structure, we don't see such an effect anymore. And again, that could be something that is very much due to the varied pedagogic orientation of centre-based settings. So how does childcare in infancy influence child well-being by age 3? Well, it's not a very clear story. We have begun to see that there is some influence of parental care in terms of social and emotional development, and that's beginning to appear in the cross-sectional data and the early longitudinal analysis. In terms of cognitive outcomes, particularly around communication and language development, there are positive effects of relative care. And that's probably contrary to what you might expect. You might expect a centre-based care to have a stronger bearing on those types of outcomes. But in terms of fine and motor skill development, we do see some positive influences through exposure to structured educational and social activities. But again, this whole idea of the varied pedagogic orientations across centre-based care, I mean, that tends to be the dominant explanation in other fields or other research that's conducted in this area in other institutional contexts. So, are childcare arrangements associated with child well-being outcomes at all stages of childhood? Because again, this is the unique feature of the growing up in Ireland, or another unique feature of it. We get to look at this snapshot of childhood and of growing up in Ireland. So in terms of parental reports of children's health, we find that non-parental care, those in non-parental care tend to be at a greater risk of being rated as less healthy by parents at all stages of childhood, so using the cross-sectional data. But of course we know then, using the longitudinal data between infancy and early childhood, that there is no such effect anymore. In terms of school-aged children, because we only had the 9-year-olds, we could only look at the associations between after-school care and child outcomes at age 9. And typically what we found was a negative association between out-of-school or after-school centre-based care and socio-emotional outcomes at age 9. And again, that is even when we control for selection into these after-school settings. So we're currently doing a bit more work on the 13-year-old cohort now to see if we can untangle some of those effects. We also find a negative association between out-of-school centre-based care and reading scores at age 9, and particularly among high achievers in reading, which is problematic. So clearly, there's a lot of policy attention that needs to be focused on after-school care settings as well. And I guess part of the rationale for including the after-school setting was to highlight this issue in the Irish context. So, are there common risk factors evident across each of the stages of childhood? Well, like all of the studies, it seems, from the Growing Up in Ireland study to date, our study highlights the importance of the well-being of the primary caregiver, and that's very much evident across pretty much all of our models. We also find that, in line with a lot of the psychological research on this topic, the role of earlier developmental indicators on later developmental outcomes is very important, and it's also very important for socio-emotional outcomes. So the pace at which children develop has a clear influence on how they develop later on. But we also know that social structure is important, and this is really where policy can play a role. We know that children with less family resources along the lines of social class, education and income, they tend to experience greater socio-emotional difficulties and poorer cognitive developmental outcomes at all stages of childhood. So for each of at 9 months, at age 3, and again at 9 years. But of course, being a sociologist as well, it's really nice to see some patterns that buck that trend, because we don't want to have a deficit conceptualization of poverty or disadvantage. And we see that in terms of gross motor skill development, it seems to be an exception, where those who are out of employment in the family, their children tend to have higher scores in terms of gross motor skill development. So it's an interesting, very nuanced picture, but the role of social structure clearly has a role to play on children's future well-being. So in conclusion, well, there has been a lot of policy focus on infancy and early childhood, but there's been less policy attention to out-of-school care and child well-being, and we've tried to begin to address that. We found that access to non-parental childcare arrangements are socially stratified from infancy right through to middle childhood, and we know that child well-being is clearly influenced by different forms of childcare arrangements, but different settings at this early stage seem to promote the development of different domains, which is probably not the clearest policy story that we might want to deliver. However, we do seem to find some positive developmental outcomes associated with centre-based settings, particularly around cognitive and emotional, or in terms of developmental outcomes, while cognitive and emotional outcomes tend to be associated more with parent and relative care. So we highlight the varied pedagogic orientations of different childcare settings, particularly centre-based, and highlight issues relating to the quality of the childcare setting. So out-of-school care clearly warrants more attention, and as the GUI goes on, we can begin to develop our understanding of that. We really highlight inequalities in early childhood and the role of family resources on child development and well-being across all stages of childhood. But because we see these persistent effects across all stages of childhood, it really does highlight the need to intervene in terms of inequalities at the earlier period. And we challenge deficit notions of less resourced families in terms of child well-being. So in terms of our next steps, we're beginning to think about changes in economic conditions and changes in the welfare state around childhood. So we're going to consider different measures of child well-being. We'll have other waves of the Growing Up in Ireland data to find out how persistent these effects are. A key issue at the moment relates to residential moves, and we want to try and tap into that using the Growing Up in Ireland data. And we're also currently thinking about the effects of the recession on childhood and child well-being, and ultimately reconfigurations of the welfare state when it comes to policy. So we see clear effects in our earlier models of the recession in terms of access to services for children, so particularly around access to childhood care and education or after-school care, but also in terms of health insurance and health cover for children. It's interesting to think about recent changes to the welfare state and the emphasis on universal supports rather than means testing that seeks to equalise childhood. So we now have this universal ECCE, but also the universal access to GP care. So we're beginning to have a look at those issues a bit further. So that's the presentation. I'd be delighted to have any comments or queries.